If you held the power in your hands to prevent one commercial airline from falling out of the sky each and every day, would you use it? 99,000 people die annually from hospital-acquired infections. That's over 270 people a day, about what a commercial flight carries. So the real question is this: what kind of caregiver do you want to be? A competent and compassionate caregiver who respects the trust our patients place in us? One who cares for your coworkers and others around you? At Norton Healthcare, we believe that every employee wants to provide the very best of care, and a commitment to hand hygiene is essential to that goal. The World Health Organization describes 5 moments when using alcohol gel or soap and water to clean your hands is key to the prevention of the spread of infection. 2 of these moments are described as before moments, 3 as after moments. The first moment for hand hygiene occurs before you touch a patient as you are approaching him or her. In other words, before touching a patient to shake hands, assist her to the bathroom, apply an oxygen mask, or take his pulse or blood pressure, as a competent caregiver, you must clean your hands. The second before moment occurs immediately before touching a site associated with infectious risk for the patient, such as coming into contact with the mucous membrane, non-intact skin, or any invasive medical device. This moment requires cleaning your hands before tasks such as brushing a patient's teeth, suctioning mucus, dressing a wound, inserting a catheter, or any other invasive device, or before preparing food or medications. The next 3 moments are after moments, and the first of these occurs after any task involving an exposure risk to body fluids has ended, and after glove removal. For example, after an injection or puncture of the skin, after removing any protective covering such as a dressing, gauze, or sanitary towel, after handling any sample containing organic matter, or after cleaning any surface that has been soiled. Each of these represent examples that require hand cleaning as soon as the task is complete. The second after moment occurs when you leave a patient's side after touching the patient. These situations include actions such as shaking hands with a patient, after helping the patient get dressed, after giving a massage, or after recording an ECG. After touching a patient for any reason, competent caregivers always clean their hands. The final hand hygiene moment occurs after touching any object or furniture in the patient's immediate surroundings, even if you haven't touched the patient. Touching the patient's bed rail, clearing a monitor alarm, leaning against the patient's bed, or clearing a bedside table. Each of these examples also require cleaning your hands after the task is complete. For the professional caregivers and others who support them in our organization, these 5 moments are familiar territory. And for the most part, we do a pretty good job at complying with them. However, we can support even better outcomes for our patients by focusing on a few hot spots for hand hygiene in our organization. Pay close attention to the 2 before moments for hand hygiene. In general, we clean our hands most consistently during the 3 after moments, but we can do better before touching a patient and before any clean or aseptic procedures. It is also important to remember that gloves protect the caregiver, not the patient. In other words, putting on gloves is not the equivalent to cleaning one's hands. Regardless of the use of gloves, hand hygiene is needed at all 5 moments to ensure our patients remain safe in our care. Urgent situations call for quick action. However, we don't want our sense of urgency to increase the chances that a patient will acquire an infection. Rub some gel on your hands while rushing to handle the situation. It's sort of like walking and chewing gum at the same time. You can do it. Be sure you fully understand what is considered a part of a patient's immediate surroundings, patient zone. If it's connected to the patient or within reasonable reach of the patient, it's part of the patient's surroundings. Clean those hands. There's one other thing you can do to protect our patients, yourself and your coworkers. Remind others of their obligation to the safety of everyone in our facilities by raising both hands or offering hand gel. It's a simple, non-threatening way to signal to a coworker that hand hygiene is needed. Creating safe environments for patients and each other is everyone's responsibility. Strive to be an exceptional caregiver, and remember, clean hands save lives.